All right, so medications that can cause hallucinations, part 2. A lot of these medications is not really common, but they're known to cause them in toxic doses or even in just some patients. So first, benzodiazepines like Xanax, Klonopin, lorazepam, stuff like that, and Z drugs. So like Ambien, Lunesta, things like that, and then also phenobarbital. All three of those are similar medications that act with GABA that have been known to cause hallucinations. Kind of interesting. Kappa agonists. Kappa is a subtype of opioid receptor. So like pentazocine, butorphanol, and albuphine. Butorphanol is a medication I've seen only a couple times in the pharmacy. It's an intranasal spray, the one that we carry, and it's for pretty bad like migraine pain. Again, it's an opioid, so it's not usually recommended like first or second line, but it's more for like last line therapy. Another medication I've talked about is mefloquine a few times. Again, it's for malaria. It's an older medication again, and it can cause some psychiatric events and then also QT prolongation in some patients. So we don't really use it that much. Chantix, I've mentioned a few times on my page, or varenicline, is a medication that can cause hallucinations in some patients, as well as like altered mood and like agitation, and also suicidality. Another med drug class that I mentioned in my last video, dopamine agonists. I'll add 2 more onto that, cabergoline and apomorphine. Something cool, apomorphine is used to induce vomiting in dogs. Say they've eaten some poisons and stuff, they'll get that. I believe it's administered IV to induce vomiting. Another drug class, tricyclic antidepressants or some serotonergic medications, usually in excess, have been known to cause this. And then singular, I've also mentioned a few times on my page, or montelukast can also cause hallucinations in some patients. And then some other random ones that had some case reports are Tamiflu, which is used for like preventative or prophylactically in high-risk patients who've been around people with the flu, and then also as treatment. If used soon enough, benzonatate is another one. It's a cough suppressant. I've heard it doesn't really help a lot of patients. Not a cough, a cough suppressant. Ketorolac is another one that has some case reports. It's like a potent NSAID, has a big risk for like kidney problems if you use it in excess and routinely. Another one is colchicine that has some case reports. Colchicine, of course, is for like acute gout like attacks. And then the last one I'll mention is tizanidine or Xanaflex, which is used for spasticity. It's an alpha-2 agonist.